Welcome to Health in Today's Woman. I'm your host, Dr. Kelly Williams. As always, this show was designed to help women become champions of their own health care. Now, one of the advantages of having your own show is that sometimes you get to do topics that maybe the other media is not covering. Tonight, I have that unique opportunity to talk about something that I think is very important in the healthcare debate and something that's not being discussed as well as I'd like it to be. What we're going to talk about tonight is rural healthcare, or healthcare in our smaller communities. To help me better understand the challenges and some of the solutions to these challenges, I have invited Mr. Jack Keller, who is the CEO of Hickman Community Hospital, and I believe it's in Centerville, Tennessee, is that correct?
That's correct.
In Centerville, Tennessee, and also Dr. Mark Durakiewez, who is an ER physician at Hickman Community Hospital, again in Centerville, Tennessee. Now, I want to start off by saying thank you for being here. I think this is a huge topic that really needs to be focused on, and the media has kind of gotten lost. Now, I will tell you, there are going to be plenty of people out there who say, we live in metropolitan communities. How does this affect us? Over the next two shows, I hope to show how it does affect you and really some solutions that we may be able to use in the larger communities also. But kind of start off, I want to take a look at a billboard that we have. And this billboard says that 25% of Americans live in rural areas, but only 10% of doctors practice in those rural areas. So Jack, I want to start with you. What's the problem with this discrepancy?
Kelly, unfortunately, it's true, and over the years there's been a gradual erosion from doctors from the rural practices, and it seems to be accelerating rather than the opposite, and difficulty lies in recruiting physicians to rural areas.
Okay, so I'm going to move to you, Mark. Why can't we recruit doctors in these rural areas?
I think it kind of starts with the process of educating doctors and the education system itself. We all know that all the residency trainings are centered around big hospitals,
right,
and they prepare doctors to work in big hospitals. And there's a fear of unknown coming from the doctors that they are not ready for rural medicine.
And the other thing I think we don't get in this particular statistic, but I've seen it before, is only 5% of medical students are going into primary care specialties. And that is a huge issue because from what I understand, that's pretty much what you're looking for. When you're looking for doctors, you're looking for primary care physicians, is that right?
You hit it on nail on the head right there. We're looking for primary care, which would include both family practice, internal medicine, and far less students are choosing that as of late and electing to go into subspecialty programs. So as a result, again, we're left hanging with too few of doctors. I imagine in this state, it's my guess, more than half the counties here are both a health profession shortage area and medically underserved as well. And what we would like to see is more initiatives to drive students into primary care regimens, but that as much as we talk about primary care in rural areas, that view is not getting across to potential students.
Well, I think this is something in my next segment we're going to discuss, but I want to talk to you a little bit about something that we used to see and we're not seeing as much of anymore, and I want your opinion on it. We used to see the doctors who grew up in these small towns saying, I want to go back and take the doctor they had seen when they were kids, whoever it might be. They're returning to that town because that doctor's getting older, maybe wants to retire. What's happened to that? Why are we not seeing these people from these small communities returning to their small communities?
I think probably because of several things. One, a lot of primary care, and especially those in the rural areas, in the past had a pretty tough schedule, and that they had to be in their community or at their hospitals quite a bit of the time. Some doctors, once they leave, get to the big city, look at other opportunities, other specialty areas, and tend to matriculate that way. They may marry, have a spouse who's, and we run into this quite frequently, also has a profession, a lot of times not in medicine, and we won't have the opportunity for that spouse to locate in our community. So several reasons that bring this about.
So one of the things I think is so important about my show is I try not to only talk about the challenges, I try to talk about some of the solutions. Mm-hmm. So what do you think some of the solutions are? How can we as a medical community begin to attract these physicians to coming back to the towns that they grew up in?
I think more incentives for help with the medical school costs, ways to defray those costs. I think help with programs to bring more technology to rural areas, make us more on the cutting edge as they are in the big city. Education of the opportunities that may lie in the small community. I would think, of course, I'm a little prejudiced, live in a rural area, but in a rural area, a doctor really is on the edge of great personal satisfaction. You know, many of these people, you see them in the grocery store, you see them in the barber shop, you see them out and about in the community. Closer ties exist, but I don't think when the kids are in school, don't think of that side of medicine. It becomes more bright lights, high technology, and whatever that can be offered in the bigger city.
Now, Mark, I want to ask you, what do you think? You're working in a small community. How do we get these physicians to want to go back there?
Again, it probably starts with the residency trainings. Doctors need to be comfortable that when they go to rural areas, they are going to provide for their patients. And there's really very, very little focus on that from residency training programs. That's one of the most important things. The other thing is changing the perceptions of young doctors. They are afraid of small rural areas. They believe that the work there will be much more difficult. And again, many of them have never lived there, have never tried to work there, and for most part, it's misconception. Actually, you know, I had the opportunity to work in big hospitals and also in small ones like this one, and there are challenges here and there, and also there are some challenges in rural medicine, but for most part, the work in rural area is more satisfying. That's first of all. And second of all is that people who you work with, you get to know them very well. Right. And that makes a difference. You know their strengths, you know their weaknesses, they know you well, and entire team works just better. While in bigger hospitals, there's such a turnover of workers and different teams, and that creates some tensions. So in that respect, the work in rural hospital would be easier and maybe more efficient.
We've had a great discussion about some of the issues facing rural healthcare. We'll be right back after these messages. We're going to focus in our next segment on how to get those residents into these rural communities. We'll be right back after these messages. Welcome back to Health with Today's Woman. Tonight we're discussing the idea of rural healthcare. Now in our first segment we discussed a little bit about the physician shortage. In this segment I really want to focus on how we get residents and other healthcare professionals into these rural communities. Now I'm very lucky to be joined by Dr. Kendra Hazlett, who is a third year,
yes,
make sure I get that right, third year OBGYN resident at Meharry Medical School. And I'm again joined by Dr. Mark Durakiewez, who is an ER physician at Hickman Community Hospital in Centerville, Tennessee. So I want to kind of start with you. And first of all, I want to tell you thank you. I mean, I've been a resident and I know how hard that is. So Kendra, I really do appreciate you being willing to come on today. I want to start with you because it's a little bit unusual, for a female OBGYN to want to go into a rural community.
Right.
And I have to tell everybody, we were in the operating room the other day and I was operating with Kendra and she said, well, I'm going to go into a rural community. And after I about fell over, I said, well, I want you to be on my show because I want you to discuss why. Because I think you're the person that we need to convince to go into rural communities. What made you think about going into a rural community?
Well, Dr. Williams, once I found out that the opportunity was there, which again, that's going to be your first hurdle to get over, is making residents and even medical students aware that these opportunities do exist. And once I did find out about the opportunity, like I was telling you, I was invited to a conference, the Tennessee Rural Partnership Conference, in October of last year. Mm-hmm. And, you know, they paid for us to come out and they just kind of put it all on the table about, you know, what is needed in those areas and how attractive it can be for residents who are coming out of residency to go into these areas, and it's really about the need of the people in the areas.
Now, I practiced, I don't know if you even know this, I practiced for 2 years in a small town in East Tennessee before I moved here. And I didn't move here because it was a small town versus a larger town. We just moved job situations.
Right.
But one of the things, I've been in there, I've come from residency and gone into a smaller community, not necessarily a rural community, but smaller community. Some of the concerns that I had, I'm interested to hear, what are your concerns looking at this, arriving just out of residency,
Right.
going into a smaller community with not the same perceived backup, as we like to say.
Right.
What are your concerns about that?
That was definitely one of the concerns, and that's one of the things that they helped lay to rest at the conference. We actually had a panel there as well, and I think the big thing is the perception of that you'll be by yourself. Especially coming right out of residency, the big nightmare that I was having was that you're in the middle of the night and you're doing a cesarean section for a woman, and for some reason she won't stop bleeding and she needs to have her uterus removed or a hysterectomy. And like, what do you do in that situation? And we've always been taught in residency that, if we're in Nashville or a larger community, that you can call the other OBGYN, or you can call your gynecology oncologist, the cancer specialist, and you can get some help, no problem. But if you're in a rural area, you might not have that access.
So how did you marry that in your own mind as thinking about this? How am I going to deal with this? How did you marry that in your own mind?
Well, with some help with some of the other OBGYNs who had practiced in a rural area, they did offer the fact that you can call the general surgeon, and also the fact that, I think what a lot of us as residents think, when we think about rural, we think about, in the country, not technologically adept, but in essence, that's not the truth. They actually do have the technology and they do have that access. You just have to find out about it.
Now, one of my big biases, honestly, for doing this show is this is one of the things I want to make sure people understand. These people in these communities are people, and they deserve care.
Exactly.
And I'm really glad to see people who want to do this, because I think it's so important that these people get care. Because what we're having a debate on is not some ideological problem. We're having a debate on people.
Right.
And people who need care, and people who need to be taken care of.
Exactly.
So I'm really proud of you, and I have to tell you that. I was very proud when I heard this, and I really wanted to highlight that because it is so important. Now, one of the things I want y'all both to address this one, because I think it's very important, because it's great to talk about it when you're a second-year medical student or a third-year resident or a third-year medical student. It's a much different time to talk about it when you're a fourth-year resident signing on the dotted line that I'm going to go to this place.
Right.
How do we make that transition from the second year, this is a great idea, to now I'm fourth year and I got to sign on the dotted line? How do we make that transition? I'm interested in both of your comments.
Well, I think that, and even now at this point in time, I'm actually getting ready to sign up now. And I think Dr. Mark here was saying earlier that there are opportunities even before you become a fourth year resident, and that if I were to sign on now, I can begin receiving a stipend, and they kind of make it attractive, and so you can start early, and then and you're committed, and so you begin to embody that thought of actually working in those areas and helping those people who may be underprivileged or underserved.
Mark, what do you say?
I can walk you through my process of becoming rural health doctor. I actually wasn't planning for that. It happened in that way because I had J1 visa, which was exchange program, and at the end of expiration of that visa, I would have to go back to the country I was from, and I didn't want to do it. And opportunity created itself in working in rural health area, which was medically underserved area. In such a case, I met requirement to have the waiver from this home residency requirement, and my visa could be changed to work visa. And I got to know that I'm going to be working in rural area over a year before I started. So I kind of had time to prepare.
Right.
I kind of assessed what I'm good at, what I have experience at, and what I don't have experience at. And I had opportunity to choose certain rotations during my third year of residency, so I could improve my skills in the areas that I wasn't comfortable at. So that was really very important, that I knew a year in advance that I'm going to work in rural areas, because the skills you need there are somewhat different. That's what you mentioned, that there is no backup, and you feel kind of abandoned to some extent, and fearful for the patient, and that can be resolved to some extent with two things. One is cooperation with your referral center, bigger hospital, and the other thing with technology. And I'm going to give you two examples, positive examples about that. When I came 11 years ago, we had limited radiology coverage.
Right.
We had radiologists coming 2 to 3 times a week for 2 hours. The rest, you are kind of on your own. You are reading your own x-rays, including your own CAT scans. So that was a change, because in your original residency training, the situation doesn't exist like that. You have 24-hour radiology coverage, and you only get to read certain x-rays that you are working on. And in my case, there were chest x-rays. My residency training prepared me very well for that, while all the rest, I didn't really have much experience, so I had to learn that. And this problem doesn't exist anymore. It was solved with technology. Now we have teleradiology, and we do the x-ray. They are being sent through the internet to radiologists for reading, and you have a report in a few minutes. So that issue resolved, and this is an example how technology can help relieve some of the anxiety of the new doctors coming to rural area. This problem doesn't exist at all, while it was a huge problem several years ago.
That is a great thing, and I want to get to your second one, but we need to take a break right here. So let's take a break, and then when we come back, I want to get to that second idea of the second thing that's changed rural healthcare. We'll be right back after these messages. Kendra, you did a great job.
Thank you.
Welcome back to Health in Today's Woman. Tonight we're doing a discussion about rural healthcare. Now, we finished the last segment with Dr. Durakiewez, and he was mentioning the two things that he thinks are so important as far as retaining physicians in these communities and also encouraging physicians to go into it. So you mentioned the first one was technology. I want to hit you with the second one because you said you had two. What's the second one?
Cooperation with your referral center. It's extremely important. And we have an example of cooperation of our hospital with St. Thomas and Baptist regarding cardiac patients. Great cooperation. You are going to have this patient that you are not sure how to manage anymore, and you know that you don't have the backup in your own place. You need to have a good referral center where you could call and get an advice on the phone, and also transfer the patient easily. That's extremely important.
I agree, because even in my fairly metropolitan type practice in Murfreesboro, we still have that. There's still people we send to Nashville, and there are people in Nashville send to other places. So I think it is incredibly important. Jack, I want to ask you something though, because we talked a little bit about retention of physicians and physicians moving to these areas. That's not the only thing that's in a hospital. Hospital is built out of a lot of different people. How do we take on that part of the healthcare issue for rural health? The whole idea of getting allied health and staff. How do we address that?
Huge problem. Everybody knows physicians, definitely a problem to recruit. But I've been 17 years at Hickman Hospital, and through that time we've had cycles where RNs very difficult to find, laboratory personnel, radiology. We have tried through the years to present programs at the local high schools and through health fairs and things like that to promote health professions. If the word was spread more to students, high school students, let them know the opportunities that are out there, more would go into those areas. people that are willing just to go to 2 years, 3 years, or 4 years to radiology, laboratory, nursing programs can make very good livings in a rural area. It's our job, though, to get the word out to convince the students to go that direction.
And one of the things we mentioned with physicians, and I'm sure it exists with allied health and with these other things, is help with, sometimes you can get help with some of the stuff. Where do these people that want to do this, if you're interested, for example, in doing radiology and willing to go to a rural community, who do they contact to get more information about going to these rural communities?
Like at our facility, can talk to our education coordinators, or I myself would welcome phone calls. But we're part of St. Thomas Health Services, and we have educational programs in which employees can move up, can get extra education as far as RN, LPN. We'd be willing to send them to lab schools and radiology schools to help them in support of their dream in return for work at our facility in future years.
Well, Ken, we're going to take a break here in a second, but I want to say thank you as we conclude this show, and we'll be back in just a second for our conclusion. But this is great that we have such great people as Dr. Durakiewez and Mr. Keller, who are really working in our rural communities that are making a difference for everybody. These people need care just like everybody else. We'll be right back after these messages. Welcome back to Health in Today's Woman. Tonight we've had a discussion about rural health care. It is very important to provide services to these smaller communities. Although people in larger communities don't really understand how that impacts them, if we can learn from the smaller communities, we can take that to our metropolitan communities. I want to say thank you for my guests for being here tonight. They are the ones that are making a difference in your local communities, and we're very lucky to have such great leaders in our Tennessee and Middle Tennessee community. We want to say thank you especially to Dr. Hazlett from Meharry Medical School for being willing to come here and talk as a resident about what it's like to go into rural health. Thank you for joining us. We'll see you next week.